Welcome, everybody. Welcome to our interview. I'm Susan Peacock, the registered dietitian, and today I have a special guest, Sandy Arioli. She is a registered nurse, and she is on the bariatric team. She's a bariatric registered nurse, and she's a psychotherapist since 2001. You may see her pre and post bariatric weight loss surgery when you're not in the hospital, but before and after. However, if you do need a consult, Sandy is the person to see for your psychological consult. And today we're going to talk about what she does best, the mind game for the bariatric weight loss patient. What's going on with your brain? And I talk about the food, but it's easy to say, eat this, don't eat this. Maybe your brain tells you something else. So let's get started. Many people after surgery, Sandy, tell me they're nauseous. Is it from the medication or what is that going on there?
I think in the beginning, for the first 48 hours, the nausea can be from the anesthesia and some of the medication. But after that, it's from mainly dehydration.
Okay.
So some of the main causes of the side effects of dehydration are headache, fatigue, nausea, and then it eventually leads to abdominal pain, back pain, things like that. So then they start to think that there's something wrong with the surgery. But what's really wrong is that they have not gotten in their 64 ounces of fluid every day. We are very hard put to give them anti-nausea medicine because we don't want their nausea covered up. We want it fixed.
Great. So we know that 64 ounces, when the patient goes home, they should have 64 ounces of 0-calorie fluid. But what's going on in the hospital? Will the hospital know right away or the doctor know if they have trouble swallowing?
Most of the trouble swallowing has to do with some kind of swelling that happens in the sleeve. So let's say this might be the size of the sleeve before it unswells. And so imagine how tight it is when people swallow and put a whole bunch of fluid on this. So that's why we talk to them about drinking very slowly. We give them a small medicine cup to learn how to drink. And rarely do we really have any problem with them getting fluids down. We overload them with fluids when they are in the hospital, IV fluids. So let me just warn you guys, don't weigh yourself when you get home because you'll be up 5 pounds or so, and that's only from the fluid. But once you get home, it's up to you.
Okay, great. The sodium holds 5 times, or no, the sodium holds 100 times its weight in water. So a teaspoon of salt, there's 100 teaspoons after it. So Sandy's right. Don't weigh because you might be disappointed. Here, you just had surgery. I get calls and go, what happened? It's the salt, and you will lose that.
And it's so sad because a patient just told me today that she went and got a liter of fluid at one of those IV bars, and she came home and had gained 3 pounds. So 1 liter of fluid put 3 pounds on her. So it goes away, but don't weigh yourself after stuff like that.
Right. The sodium is the electrolyte. So you won't, yes. So people say, oh, I want electrolytes, but it's sodium. Some of it is sodium. Right. That's good.
Right.
So if they don't have trouble in the hospital sipping, and what that cup you mentioned, how much is in that cup? An ounce or a half an ounce that they're practicing?
It's definitely 1 ounce. Okay. But I always tell everybody it looks like a shot glass, but that doesn't mean you should treat it as one.
Very good. Yes. And sipping, no guzzling. I always say with this water. If you forget, you shouldn't go back and go, okay, I can do 8 ounces in one fell swoop. And I always say to the patient, have the fluid with you like your cell phone. You wouldn't leave your cell phone hanging around, or you wouldn't be without it. So the same thing with the fluid. And if you have to set an alarm on your phone, or they have cups with alarms, please do so, because it's an easy preventive fix not to get dehydrated.
And you know what else? one of the things I tell people all the time is I'll hold up a cup like this and I'll say, how much is in here? And they'll say 8 ounces, 10 ounces, 12 ounces. What you really don't know is how much is in here. So you need to measure it. Sometimes you can get containers that have 64 ounces in them, and it reminds you every hour. You can buy those on eBay, not eBay, what's the other one? Amazon. Amazon, and they'll talk to you every hour.
Yes, yes. Let's
and they
use
light
these.
up and flash. So if you need it, you need it.
Absolutely. And there's plenty of websites that sell this stuff for bariatric patients. So please investigate. Part of this series of this program is for you to get ready to take charge. We can talk till we're blue in the face, but we want you to take charge so you are successful with your weight loss and you don't have any problems. And it's not easy to do because things have changed in your body, but with preventive maintenance or preventive knowledge, you can do it. That's great.
Right. And just to add one thing
Sure.
is, left to our own devices, we got to this place. So you do have to measure, you do have to know how much you're getting in every day, and you do have to watch for the side symptoms of dehydration. One of the things you should do too is check the color of your urine. So you're checking the color of your urine and making sure that it stays light enough all day so that you know that you're hydrated.
Yes, yes. And it's hard to go to the bathroom when you don't have enough water. So you can become constipated, which is another domino effect.
Another dilemma.
Yes. So water, folks. Remember, we're already not drinking carbonated through straws or juice. So 0 calorie or 5 to 10 calories per serving, I add, because that's what Crystal Light is. Okay.
Right. So no bubbles, no sugar, no juice.
There you go. That stays the same forever because we don't want you stretching that stomach, and the carbonation and the air that comes through a straw can do that.
Right.
Very, very important. Now, when we get home, I always tell the patient, we need to walk and move. Okay. That's for circulation. That's so you can go to the bathroom and you heal faster. What would you say about that?
I think that a lot of times the heavier we get, the less we want to move. And so sedentary behavior becomes a part of our lives. Right. So we have to go ahead and move forward and get off the couch. I always say that you have to pick the microfibers out of your butt and move on.
There you go. That's a good one. Yeah, that's a good one.
Yeah.
Yes.
So, but it's our usual idea that we don't want to do too much moving. And the good part about this surgery is it's going to give relief to your joints, to your knees, especially in your hips, in your ankles.
Absolutely. And back to the fluid, I just had a thought, 64 ounces is a half a gallon. And as you said, people don't understand or don't know what they're drinking. And they say, well, I had 3 bottles. Well, how big are the bottles? So look at your ounces. And in this program, we're going to talk about the nutrition fact label and how to look at the serving size and to really know what you're putting in your body. It's such an important part to your new healthy lifestyle. Great. So let's talk about what's going on in our brain. We know that the ghrelin has been cut out of our stomach. We're going to be losing 80% of our stomach, and we're not having that hunger hormone around anymore. But what if a bariatric patient is an emotional eater?
Well, that's a whole book, Susan.
I know. So let's break it down. What would you say to them when they say, I'm hungry, I'm hungry?
Okay, so are you talking about after the surgery?
After surgery, post-surgery.
Okay, so in the beginning, when 80% of the stomach is cut out, there really is not very much hunger, but sometimes there's a feeling of emptiness. It's like a feeling of being empty, and we start to think that means we're hungry. So we might equate that to being hungry, but in reality, it's really about feeling empty. And sometimes fluids will help that, protein shakes will help that, things like that. Now, rarely, some people will wake up thinking they need a hamburger, but if that happens and they do eat one, they will be very sorry. So I caution them to be aware of the feeling of emptiness as opposed to it really being hungry. A lot of times it has to do with your brain. I want something. I feel miserable. I need to be comforted. Where is my blank? Whatever it is that makes you happy.
So moving to that healthy lifestyle, we want to have a list of things to do when we're feeling that, because we need to go to that place other than food, because we won't be able to.
And you know what, Susan, that is the key to recovery. You just said it. You need to find alternative coping techniques so that you will be able to deal with your feelings. Once you are not able to have the food that you want, your feelings are bound to come up a little bit more. And in that case, what are you going to do about it? So we ask you to try to prepare ahead of time so that you're not in the moment and figuring out, what do I do? What do I do?
And as a psychotherapist, would you agree that once you acknowledge, oh, I'm not really hungry, I'm just frustrated because I can't eat, or now I'm a little depressed because I've had surgery and I'm home and I can't do anything. So let's make a list, grab a magazine. If you're walking, take a walk, talk to a friend, watch a movie,
take a shower.
Take a shower, always does it, hot shower.
Exercise helps. There's a myriad of breathing techniques that help. When we are having actions, what really happens first is the thought, the feeling, and the action. So if you can put a little bit of distance between the feeling and the action, you might be able to save yourself. And you can do that sometimes with breathing exercises. There's also funny things that people do, like putting notes in their refrigerator that say, "You're not hungry. Stop looking in here."
I love it. I love it. Good, good.
Yes.
Yes. Some preventive ideas we want our patients to get, so they know that if this happens, and chances are it will, that you can handle it. Great.
Exactly.
And what about the people who are grieving because they cannot eat like they used to? They know they need to lose weight. They know they're unhealthy with all this extra adipose tissue, we're going to call it. And they've gotten the surgery and now they're faced with, oh my goodness, this was what I lived for, the food.
So when we take the food away, there's like a natural grieving process. And the first thing I see when I was working in the hospital and I would walk into the rooms the day after their surgery and I would see this. What was I thinking? I should have tried another diet. And that has what's called denial. I can't believe I did this. Then the next thing that happens is, and they're never in any particular order, is sometimes anger. Okay, sometimes sadness, but most of the time it comes across as irritability and being mad at maybe their family or their friends to have the nerve to turn on the stove, and they have the nerve to order a pizza or bring wings or something in the house.
Right.
And so that kind of shows as irritability. So I always counsel patients, if you have more than one person, and it's not your husband or wife, who says, "You're so crabby lately," or "You're so irritable," pay attention, because there's a very good chance that you really are, and you need to talk about it. You need to either call here, have a therapist, talk to a friend, but you have to be open about it. And you know, Susan, the people that are the most open about it, believe it or not, are men. They're the ones that really grieve the loss of their volume and, you know, all the things that they want to eat. Right. So I really like to talk about that with the groups and things and see where they are with everything.
So how can we prepare our family, Sandy, so that they want to eat regular stuff? They didn't get the surgery. What can we say to them before the surgery so that the patient doesn't experience the pizza coming in and the wings? which may happen because it may be a family affair, this overeating, correct?
So what we want to tell them is don't eat in this house, but that's not what we can tell them.
Right.
We want to tell them that we're going to be going through a period of upheaval, emotional upheaval. We don't mean to be crabby, but losing the opportunity to eat what we want, when we want, to soothe ourselves, to deal with our emotions, etc., is going to be gone. And so we're really working on coping and learning different ways of coping. Sometimes you get cooperation from your family, sometimes you don't. Always have to remember, whatever comes out of somebody's mouth is about them and not about you. It's about how they feel about something. And sometimes they worry that you're going to be a little bit different when you're thinner. Sometimes they may want to sabotage you. So those are all things that I like to talk about with people.
And what about friends who were eating buddies, so to speak?
Oh,
And I've had patients who say, I lost another friend, and we talk
yes.
about it.
Yes.
And I try to tell them, or I encourage them, because everybody has down times in their lives. But I always say that it's a nice hole to sit in for a while because they're missing something, but let's fill it with positive life. Figure out what's next. There's got to be other friends out there that are going to be encouraging and not worried that, or not feeling like you only ate with me and now you're not really worth being my friend because that's all I wanted you for.
Exactly. And sometimes they also feel some shame because you're doing something about your obesity and they're not, so they can't face you. It's again about them.
Yes. Yeah.
It's again about them and how they feel about the situation.
And letting go of them and moving on.
Exactly.
Sometimes you have to do that with relatives too. So it's a big, big change for everyone.
It really is. And I think that it's 90% mental. I don't mean to encroach on your area over there, but
no, I know. Yeah. I've had patients say, I wish they would just operate on my brain, forget the stomach, right?
Just imagine one hot probe. We'd be so happy.
Everybody be trim, slim, right?
Right.
Well, but this surgery or post-surgery brings up all these things. And I think that's part of moving through to a healthier lifestyle. You knew that you didn't want to be heavy, but why were you there? That's where you're facing those questions.
Exactly.
And they come up in different areas. Yes.
Exactly. When we were talking about, I don't know if you have this on the list, but I wanted to make sure we didn't pass it.
Please.
When people say, I'm not eating because I'm not hungry. Because when I do follow-ups, like I do a follow-up form, and on the form, it asks things like, are you doing this? Are you doing that, etc. And one of the questions is, are you eating at least 3 meals a day, blah, blah, blah. And sometimes I hear, and frequently, unfortunately, I hear, I'm not hungry, so I'm only eating 1 meal a day. And I then have to say to them, because I don't know if you guys realize this, but I'm definitely one of you. So I know how we think. And here's our thought process. I'm not hungry. Yay. I'm going to give into it because I'm never not hungry. It's so exciting. Yes. But you can't give into it, you guys, because if you give into it, you won't lose weight. And Susan, you agree with this, I'm sure, that if you don't eat, your body goes into a starvation mode and holds on to every last ounce you have.
Well, and we need the protein. We do talk about protein, because that's the metabolism fire. If you make a fireplace and you don't throw that match in, that's like not eating your meals, and that's not eating your protein. So yes, you're going to be eating less, but we do need those meals. But it also gets you into the habit of breakfast, lunch, dinner. And being mindful that you're hungry, but you can stop eating because you don't need that much.
And sometimes I tell people that eating like a small amount 5 times a day of protein is helpful. if your metabolism is really slow. It's just like you said, your analogy of the fireplace. Let's say you got it burning because you ate breakfast, but what do you do 2 hours later when the fire burns low? What do you do 3 hours later? We have to throw in another log. So I
Right.
use that same analogy,
That's
and you
good.
just have to keep it burning.
Keep it burning. And the body doesn't like to be starved, whether you
Yeah.
just had bariatric surgery or not. Every 3 to 4 hours, we should have something to keep things
Right,
going, because you're
right.
asking your brain to work, your lungs, your heart, and we need fuel. And of course, we want good food. We want quality food over quantity, which is what happens after surgery. You're going to be eating better food. And we talk about that in our program of what is good food and how do we get it.
That's
Great,
right.
great.
And telling me that you're not hungry makes me laugh, because I know that we know how to eat when we're not hungry. Visualize Thanksgiving when you can't even move and they say, "Who wants dessert?" And we all go, "Okay." So don't tell me you can't eat when you're not hungry.
Now, Sandy, you say to or you're saying to us as if you had the surgery. You had the bariatric surgery, did you not?
No, I did not. But
You did not. Okay.
had I thought backwards a little, I probably would have done it, because you know what, Susan, it doesn't get any easier as you age. And I just thought, oh, well, maybe when I get to be my mother's age, I'll lose weight like she did. It didn't work.
Okay. Yeah. Yeah. But we
Yeah,
understand the high BMI mind, or you do
right.
for sure. Yes. And
Yes,
we have to,
definitely.
we're dealing with that. This is just a tool, this surgery. And sometimes
Exactly.
I see people there, they just want to get to the gurney. They just want to get in that hospital. And this preliminary information is so important. So please, this is going to be for you, this interview. And if you want to watch it 10 times, please do. So you learn. Now, post-op, and we're back to the liquid. I do have a list of fluids in our program package, and you may need more than one. Some people say, I just need water. That's fine. You may not like the taste of water. You may not like the taste of the Gatorade Zero or Powerade Zero after surgery. So have a variety, have a stocking shelf of fluid for you. And mainly because your taste buds may change. And if you are swollen, you may need something warm. Maybe you need broth, maybe you need tea. What can you say to that, Sandy?
One of the things that I've heard some of the patients tell me is that alkaline water is something that they're able to tolerate much better than regular water. And I'm not sure if it's because our pH changes after the surgery or something like that, but it's definitely an aversion to regular tap water, or what comes out of the refrigerator. So all you really need to do is flavor your water somehow, or you can get the that alkaline water, which seems to really go down much easier. And I tried it myself, because I like to try what the patients try,
Sure.
and it tastes softer. I can't explain it. It
Yes.
doesn't have those chemicals in it and things like that.
Yes. And it's probably a lot of, or filtered, quite filtered.
Yes.
But also a little lemon juice makes an alkaline water, just a little spritz. Okay. Because your
Yep.
body always is going to bring it back to 7, your pH.
Right. Right. And throwing in some fresh fruit on the bottom, as long as you don't eat it, is a good way to infuse your water
Yes.
with some flavor.
Infused water, yes, with cucumber, fruit, pineapple, which is fruit, but also a little cayenne. If you get a little spike in your water that tastes good. Yeah.
Mint,
Mint, all of
crushed
that. And we have recipes in our program packet. Yes, for that. So infuse
Okay.
water, but don't eat the fruit. Fruit is carbohydrate, everyone, and we're not doing that now. Our main focus for 2 weeks post-op is fluid, fluid, fluid. Try something different if you can't get it down. Some people call me and say, I can't swallow, they're swollen. let's try something warm. Let's try a different flavor. The
Yep.
teas that do not have caffeine are delicious. The
Right.
smooth move can help sometimes with constipation.
Right.
And since I may mention that word, let's talk about that. Is that mainly because of not enough fluid, or what can they do about it?
If you think about the amount of food that we ate before the surgery, let's say, even though we all swear we don't eat much. Don't.
That's true. Some people drink, 650 calories in a Starbucks coffee,
I know.
and they don't
We
eat
don't
much.
eat much.
Yeah, that's true. Absolutely.
So, oh gosh, what was the question?
We're having some fun here today.
I
I
know.
hope you guys are too. Constipation. I know you
Oh.
didn't want to talk about that.
Well, if I didn't get calls about constipation, I'd be very lonely.
Yes.
That's how often it
So
happens.
let's think about this. If she didn't get calls from constipation, she'd be lonely. We'd have to call her up and make her feel better. So that means that we want to take care of it now, folks.
Right.
Let's
right.
listen closely.
So I usually ask the patients to get some Colace, or it's called the stool softener. Docusate is the generic name for it. Have that in the house and take it 1 to 2 every night in the beginning, because you're very dry. You're not getting in fluids by your food. So think about all the fluids that are in things like fruits and vegetables, and we're not allowing you to have that. So what you're getting in is, pretty much protein, and there's hardly any, what's the word I want in there? There's not much fiber. There's not
Fiber.
much fiber in there.
And no fiber in those protein shakes. Yes, it's a stop it up. Yeah.
Yes. And so, and you're not getting in very much food. You're lucky to be getting in like 300 calories at the most by 3, 4, 5 weeks, etc. And so there's not very much volume to come out. So that makes you feel pretty tight, I guess. But the constipation, you should not ever let it go past a week after the surgery. And in the packet, Susan, are you putting in the constipation handout?
Yes, absolutely.
Okay, so they'll have access to that and
Yes.
how to deal with it, correct?
Yes, let's read our packet, please, please. This is your Bible to bariatric surgery. So if you have a problem, please go to that before you call the nurse or the doctor or the hospital, because there may be a solution, and most likely there will be.
Right, because we put the packet together with the idea that we've talked to most of you about many, many things, and we try to teach you ahead of time so you don't have to suffer. We don't want you to suffer. We want you to have a very good and easy enough recovery. But constipation is definitely something that you're going to have to look out for. On the other hand, if you have diarrhea, sometimes after the surgery, Dr. Shillingford will do an upper GI, and the gastrographin that you have to swallow for the upper GI can cause diarrhea for sometimes up to 10 days. So the real definition of diarrhea is 3 watery loose stools or more per day. So 1 loose stool a day is not cause for alarm. That's just a loose stool. That doesn't mean you have diarrhea. So look at it in that way. It's about the volume that you're losing as well.
But you are losing extra fluid, so that's where more fluid comes in to play. And I wanted to mention that most people are using that Premier, but any shake is about 70% water. And of course, we also suggest eating yogurt, even though we're saying fluid. You can have yogurt, and we want less than 10 grams in carbohydrates, 10 grams of carbohydrate or less, high protein, 12 to 15 grams in that yogurt, because some of the yogurts, and I always recommend 000 or Too Good, some of the yogurts are so high that it's like a dessert, high in carbs, and which means sugar. So let's make sure our yogurt, but there are so many different types. I'd rather have you choose the right one, knowing the label. Okay, and we do talk about that in the program. Also, sugar-free Jell-O is considered fluid. So 4 ounces of sugar-free Jell-O is 4 ounces of fluid.
Okay, and we sometimes consider sugar-free pudding also a fluid.
Right.
And we ask that you make it from scratch from home, as opposed to buying the pre-made ones, which are filled with God knows what. So if you bought the sugar-free pudding powder and mixed it with 1 cup of zero milk and 1 cup of protein shake. So if you had chocolate pudding, you put in Premier chocolate, 8 ounces of that, and then you have a protein packed pudding, and much easier to get down and much tastier than some of the other things.
Right. That's a great thought. And you can also do that with the sugar-free Jell-O, make it from scratch and add the protein powder. The Gen Pro or the Vital Collagen is tasteless. So now
Right.
you're adding protein and fluid at the same time. And don't
Right.
forget about the clear protein, the hydrolyzed protein. Premier has one, Isopure, that is clear. It suffices for fluid as well as protein.
Exactly. Speaking of collagen, Susan, what do you think about it? Because I've been around long enough to know that collagen was real popular in the 70s and 80s. Then it went under, and now
Right.
it's up there again. What's going
Right,
on with that?
right. Well, it's not as much protein in there as protein powder, but it
Mhm.
seems to help the hair growth and it helps
Yes,
the skin. Yeah.
yes, yeah. And
So,
nails too.
and the nails, because that's what you, I think you were talking about in the 60s, you know, they would have the Knox gelatin for the nails. We would
Yes,
drink
yes,
that, right?
yes, yes.
So
Oh
the
man, flashbacks.
yes, the vital protein is one of the best, but there's several, the vital collagen protein. So
Okay,
check it out. And I always say to patients, you know, you're trying new stuff, you're buying all these products, you want to be ready, save those receipts. If you open it and you go, oh my God, I can't take another bite, or I would never use this, take it back and get your money back. They will take it back no matter where you go. Okay. So that prevents you from saying, oh, I don't have that much money, or I don't want to buy all this stuff. You can take it back. They don't care. If it's open, that's okay. But I want you to be ready. And you can't just have one fluid. You can't have just one type of protein. And that vital collagen goes right in tea or soup. Nice.
right.
Yeah.
And even in your water bottle, people have told me that they put 1 packet in every day, and that their hair is doing much better and things like that. So,
Absolutely. Absolutely. And the skin, which we're worried about because of the weight loss and the stretching. So it does help somewhat. Absolutely. And you know, skin is a difficult thing because it depends upon how long you were heavy, how old you are, what type of skin, what kind of muscle mass. You know, usually men have more muscle, so they may have less skin issues, but there's so many variables in that arena. Do you have any thought on that?
I just know that you can exercise until you weigh 1 ounce, and you're not going to fix your skin.
Right.
You can, get your muscles and tone up, but you could still have a lot of skin. Like, for instance, if you were in your 50s and you've been dieting on and off and up and down, your skin is not going to have elasticity anymore. I'd say 18 years and over.
Right.
You're going to have something, like I just say, tuck in that skin and move on. But some people want it cut off. So I guess what you're going to have to do is start saving your money, because it's definitely never covered under insurance.
Right. And many patients call me and say, I have only 15 pounds left. And I said, well, could it be skin? It could be skin that is
Right.
keeping you from getting to that. Or
Exactly.
do you need it? Meaning, do you really need to lose the 15 pounds, or is it just skin and you need to do it because you don't like the way things look?
And sometimes things tighten up a bit too, because
Mhm.
it could take 3 months on a normal diet to lose 10 pounds, but after the surgery, you may have lost 30 in the same amount of time. So as time goes on, it catches up a little bit. Many times family members will say things like, oh, you've lost enough weight, stop eating. You look like you're in a concentration camp, blah, blah, blah.
Right.
Again, that's about them. They're worried about you. They're worried you're a different person because you're skinny or whatever. Please check with us and we'll tell you if you're too thin.
Right.
We'll tell you if you're in a danger zone of some kind.
Right. And we will have that BMI and how to figure it and what it means in your packet. So you can address those questions with that as well, because that is a tracking of whether you're healthy, unhealthy, or too thin or too heavy.
Right.
30 days after the surgery, Sandy, the patient should start their vitamins and their supplements. Okay. So
Yep.
their stomach has been cut, as we mentioned, 80%. We've got a 3-ounce stomach. We have less surface area, even though nutrients are absorbed through the stomach and the intestines. And if you got a sleeve, your intestines are intact. You still may have risk for becoming deficient in various vitamins.
Okay.
And go ahead.
I was just going to say that Dr. Schillingford's rule of thumb is that you should start your vitamins about a month after surgery, because in the hospital, he's going to have you vitamin B12 injection so that you're good for a month with the B12. And then usually we give you a bag of vitamins, and they call it a banana bag because it's yellow. And that's how you'll know if you got your vitamins or not.
Right.
And then that's the reason why we wait a month. Also, we wait a month because your stomach is all calmed down by then. Also, don't ever take a vitamin on an empty stomach. Oh,
okay, good.
The nausea. So don't take it on an empty stomach. Maybe take it 20 minutes after your meal.
Okay.
So that there's something there so you don't have that nausea.
Right. And chewable, of course, is one option because you may not feel like swallowing a big pill anymore. Sometimes the insurance company will cover your vitamins, but they'll be swallowing pills. They won't be injections, or they won't be liquid, or they won't be chewable. So again, try different things. Make sure you get your vitamins and supplements every day, or whatever the requirement is. And we have our lists in our program, especially B12. And what I found is that bariatric patients weren't eating that well before. And now we're learning a new healthy lifestyle. So quality over quantity. So we want good food so the body has something to pull from. Okay. It's not just eating less junk food or fast food or Twinkies. It's eating good food, less of it. And the body is a miraculous machine. It doesn't need much to function well.
That's true.
Yeah.
But I mean, you just have to go to Europe and see what they eat there. And when you go there, you think, okay, well, that was the hors d'oeuvre. Where's the dinner?
Where's the right? And they eat those big breakfasts, small lunches, and then hardly anything for dinner. And they take a walk in between. Yeah, it's a whole different world. But the preservatives, they don't have the preservatives and all the extras in their food. It's fresher.
Yeah. And the GMOs too.
On the GMOs, they're big on that. That's a big deal. Yes. Yeah. Absolutely.
I agree.
And liquid vitamins, there are liquid vitamins available for patients, but
B12 drops are. So let me just say for a quick second that B12 cannot be absorbed if you swallow it whole after 80% of your stomach is removed. So the only way you can take B12 after the surgery is by chewing it, putting it under your tongue, having a shot or a nasal spray. What my point is it has to go into your mucous membranes to be absorbed directly into your bloodstream. If not, it's just a waste of time because your stomach cannot absorb it.
Right. And
so
even
that's the B12.
I'm sorry.
The vitamin.
Go ahead.
Okay, I was just going to say that the vitamins that I check when people come in for their follow-up, and I do my checklist, and then I look specifically at B1, B12 and vitamin D. Those are the things that seem to be in deficit with you guys sometimes. And
Yes.
so that's the things I look at, plus your iron, plus, your hemoglobin and your blood sugar, all of that stuff, all that nursey stuff.
Yeah.
So,
Yeah. So
and
when do you check that blood after surgery with patients?
so we check it at 6 months. So there's time for your blood sugar to go down, your cholesterol to get better, some healing that goes on. And I can tell if you take your vitamins. Like I had somebody right before here, and I just looked at her and I said, "Are you taking any vitamins?" Because all of her numbers were down. And, sometimes they'll say, "Yes, I take them." I go,
Mm-hmm.
and then they admit it.
Yeah. Yeah.
You know what I found out, Susan? Us bariatric patients don't always like to take care of ourselves. We like to take care of others. We're a whole lot of caretakers,
Yes.
and we take care of our families and our friends and our workplace. And we have a very hard time giving time to ourselves.
Absolutely.
So my word to the wise is always treat yourself like your own child.
Mhm.
If your child was low on vitamin D, you would chase them around the house until they swallowed that pill.
Right. Right.
Right?
That's
Okay.
right. And
So,
I add to that is if you had a new Ferrari or a new puppy that was a purebred, $10,000, you would read everything about it, make
right.
sure that they get the best food, the best veterinarian on the planet, all their supplements, go to the vet, make sure they get that exercise. So why don't we do that for us? Because we only have that one body per lifetime, and lots of people didn't make it here. So we need to be cognizant of the fact that it's so precious and that they're getting the surgery and they're going to add 20 years to their lives.
Exactly.
Not to mention getting rid of diabetes, high blood pressure, high cholesterol.
Right.
And for
And that goes
ladies who,
quick.
pardon?
That goes quick. Do you know we take our patients off of most of their diabetes medicine like the day of surgery?
Yes, get off the gurney, I say, and you're
Yeah.
done. Yeah, it's amazing. It's
It
amazing.
is so helpful. So
Yes.
helpful.
And then you don't have that expense. You have the energy. You're not sick. You're not a sick person anymore. It's wonderful. Absolutely. And for the young women, you can get pregnant very easy when you've lost all that weight. So if you don't want to get pregnant, please take precaution, because if there's any sperm around, you're going to catch it.
That's right. It's the one time you get pregnant off the toilet seat. You know how your mother said, "You can't get pregnant off a toilet seat."
Yeah,
This
that's
is the
right.
one exception.
Because I have many patients who get the surgery because they want to get pregnant and the doctor said you need to lose some weight. Yeah.
Yep.
Yeah. Oh.
And you have to wait a year, Susan. Some doctors say 18 months, but we're pretty firm on a year.
Okay. And that brings me up to another question. Red meat, 10 weeks, a year, 6 months. What do you say to have red meat post-op?
On our scale of when you can start eating things, it's like stage 6, where you can try some, but you certainly cannot have low quality red meat. It just won't go down. Some stomachs will never handle it again. So you have to have very high quality red meat if you're going to have it.
And lean.
And lean and soft, because
Soft.
yeah.
Steak tartare. Steak tartare is probably the softest. It's raw. But okay, so what did you say? How long?
So stage 6, and it's probably about 3 months before you can even think about it.
So that's 12 weeks.
Yeah, that's about right.
Okay.
That's about right.
Okay. It's good protein. It's great iron, but your stomach can't handle it. We don't want you throwing up. So don't push those phases. Don't go too fast. Some people can go a little faster to one phase to the other. Others have to stay in a phase longer because they're just not ready. So be respectful to your body and go slow. And even though you're in the puree phase, that puree needs to be done on the plate, made on the plate, whatever food you're eating, puree with a food processor or blender. But then in the next phase, the 5th week, you're going into regular consistency. That doesn't mean that you can't, that you're not supposed to chew anymore. You still need to chew to puree
Yes.
consistency.
Right.
Yes.
Right.
Very
Because
important.
dry is very difficult for you to get things down.
Yes.
So I always say dry is deadly. I mean, imagine our staple for every diet on earth, white meat chicken,
Yes.
trying to get through a hole maybe about this size.
Right.
So we have to be real careful with things like white meat chicken seems to be a little bit more dangerous actually than steak.
Yes. Well,
unless you puree it or do something to it.
puree it, add a little olive oil, a little mayo, low-fat mayo.
Right, right.
And then, of course, dark meat is always a little fat. More fat has oil.
Yes, and
Yeah.
goes down a little bit easier.
Absolutely. Absolutely.
Yeah, yeah.
All
What
right.
do you think about the difference between regular mayo, low-fat mayo, and no-fat mayo?
Well, I don't like the taste of no-fat mayo. Most people that tell me about mayo and diet mayo, they call it, they don't like the low fatty or no fat.
Right.
Because the
I agree.
consistency, there's no, yeah, it's not real mayonnaise,
No.
right?
No.
Mayonnaise is made from eggs and oil. So
Right.
I always buy the low fat made with olive oil, or there's some low fat made with avocado oil.
I didn't see that.
Yes. So those are the ones I recommend. And a little
Okay.
bit of that mixed with eggs or tuna fish or chicken. You can make a white fish dip, call it a dip, but it's puree. Okay. So your brain thinks, oh, not too bad. It's not like I'm eating baby food.
Right, right.
And many people say, can I eat baby food? Those little jars. I said, yes, but you want to make sure it's protein, not pureed mangoes.
Yes.
Okay.
I can
So
remember
baby
when my-
food means protein, fruit, vegetables. So make sure you pick
Right.
the right one. Yeah.
That's right. That's right. I always say that baby food left to its own is really not very tasty, but you can spice it up if you want to.
Absolutely. Absolutely. Sure.
Yeah.
Sure.
So what do you
Absolutely.
think? Do you think we told them a lot of stuff?
I think we did, and we're just about wrapping it up. I would like to ask you one big question. What is something that maybe we haven't talked about and you'd like to talk about that you want every bariatric patient to know?
And I've talked about it through this, but I have to say it again. Hydration is the most important part of this whole situation as far as physicality. If you can keep yourself hydrated, you will be successful in this surgery. It's the dehydration that continually gets people in trouble. Psychologically speaking, I think the most important thing is understanding that there is an emotional component to it and not denying that fact.
Right, right. And
What
maybe
about you? What do you think is one of the most important?
I would say fluid and understanding what's so important as we discussed. But many patients say, oh, I'll just go to the drip, get a drip. And I say,
Right.
you know, that's expensive, number one. Number two, you're having somebody put a shunt in your arm, a needle in your arm. Why do that? Especially during COVID. So let's just do what we're supposed to do. The times that we've not done what we needed to do for our body is gone. We need to respect our body. You've gone through this. You've paid a lot of money. It's not easy. Don't let anybody tell you this is an easy way out for weight loss. So let's just turn it all around and say, I'm respecting my body. I've got my parameters. I'm going to exercise. I'm going to eat well. I'm going to take care of myself. And that's what I hope for everyone, because it's being strong and saying to yourself, I'm going to be healthy no matter what. And I know how to do it now. And I had the tool to help me get there. So I'm getting an exercise program and I'm going to do it for the rest of my life, even if it's just walking. Very, very important. That's key. Yeah.
Well, thank you for giving me this time, Susan.
You are welcome. My pleasure. And thank you so much for everybody. Please watch it 1 or 2 or 3 times. Take care.